Tell me, Dr. Crow, why is it that you still use LSD for your researches here in Switzerland when we both know that it is being prohibited because of its harmful effects? I mean, do you really think that it could actually be used in I don't know, psychiatric treatment or something?
Okay, the first question you need to ask yourself is, why has LSD been prohibited? It's because people didn't know how to use it properly at the time, so everything went out of control, leading to its prohibition because the government didn't know how to react. In fact, it has already been shown in the past that an appropriate dosage of the substance has therapeutic and psychiatric benefits.
Oh really? Can you give me an example?
Well, Dr. Kahn, I'm surprised you haven't heard of the benefits provided by this drug. So you see, LSD's influence can activate some parts of the brain which make you remember lost memories or experiences. When this phenomenon happens, you don't only remember them, you literally relive the experience in question.
And how do you manage that? Is there some kind of therapy that leads to this so-called phenomenon?
Of course, there are two types of therapies. The first one is a psycholytic therapy, based on the administration of average doses of LSD during specific intervals of time. In this case, LSD experiments are communicated in groups of people or by paintings, painting being considered as a therapeutic way of expression. So the other method, more appreciated in the United States, is psychedelic therapy. So it's supposed to lead to a mystico-religious experience caused by an effect of shock. This effect is provoked by giving the patient a very significant quantity of LSD all at once. I'd say 0.3 to 0.6 milligrams.
Very significant quantity? Effect of shock? Is that incredibly harmful to human beings?
Most people think that, but in this case, it helps the reorganization and the reestablishment of the patient's personality.
Well, that's interesting, I guess, but it's still not enough to convince me. I mean, I have studied LSD myself, and too big a dose can be mortal. Besides what are known as bad trips, I mean, they can provoke terrifying nightmares that some are incapable of coping with. I'm really not sure such a substance should be used too much.
I agree, but many experiments have been led, and the results we have found are far too interesting to ignore. For instance, it can alter criminal and sexual behavior.
Don't make me laugh, Dr. Crow.
It's true! It has also an effect on alcoholism, and this has been proved in the early 60s in Canada. So, a single dose of this hallucinogenic substance, provided in a clinical environment, can be an effective way of a treatment for alcoholism.
And how does that work? I mean, alcoholics just give up one dependency for another? Is that it?
Absolutely not, because first of all, LSD is not an addictive drug. This has been proved too, okay? So, in any way, the cure for alcoholism would be incurred in controlled quantities and in a clinical environment. Besides, LSD somehow gives people experiences that psychologically take them outside of themselves and allow them to see their unhealthy behavior more objectively, and then they determine to change it. You see, it's fascinating.
Well, it does sound quite incredible, but I don't know. Maybe I should look into the matter more seriously. If all this proves true, LSD could be the medicine of the future.